Hello, Milan. Hello. How are you all doing? Good? Are you having a good time? Perfect, perfect. So this is actually my second ISDH. I was in Seoul as well 2 years ago, and that was also the first time I was hosting this awards ceremony. And what really struck me at the time was how proud everybody was. Everybody in the audience, the 6 winners of course, there's really this sense of pride that really struck me. And it was really being part of a community. And because of that, I wanted to start with a question today. A question to you. What makes you proud to be a dental hygienist? Your patients, your colleagues, anything that comes to mind. And don't worry, I'm not going to give you the microphone. Instead, we have prepared a little quiz for you. So all you have to do is grab your phone and scan the QR code, connect to the quiz, and just type away. What makes you proud to be a dental hygienist? Let's see if everybody can connect. And just start typing away, whatever comes to mind. Community, yeah. Passion. Saving lives, oh. I still see people connecting, so it seems to work. Perfect. Helping people, education, prevention of course, making a difference, passion, yes. Very nice. Very nice. A lot of nice thoughts, and I think if you see the answers, this beautifully resonates also with the winners of today that we are celebrating. So if we go to those winners, if we go to the next slide, I quickly wanted to share a little bit of background of the awards, because we started already in 2024 with this cycle, and in 2024 we opened 2 regional awards that act as a qualification round, one in North America and one in Europe. And we did the same in 2025 with the 2nd edition. And in that same year, we also opened up the nominations for the rest of the world. And as you can see, we ended up with more than 400 nominations from all over the world. And out of those more than 400 nominations, only 6 were selected as winners. So I think it's safe to say that we are truly experiencing something unique today, and we are really celebrating the best of the best. And I think that's something, yeah, a big honor to be here today. So we have 6 winners, meaning we also have 6 categories. So we have 1 winner per category. We have public health, full-time clinician, academia, entrepreneur, new RDH, and research. So these are the 6 categories of the winners. And Sunstar is not involved in judging these nominations. We had the support from the IFDH, who have an awards committee, so I also wanted to express my gratitude to these 6 amazing members of the judging committee who went through all these nominations one by one and selected the 6 best. So big thank you to this group. And with that, I wanted to go to the beginning, because all of this would not have been possible without the support from the Sunstar Foundation, who was the founder of this awards program. First edition already in 2007. So I now want to give the floor to Ms. Mayumi Kaneda, who is the director of the Sunstar Foundation. So Mayumi, the floor is yours.
Good morning, everyone. My name is Mayumi Kaneda, director of the Sunstar Foundation. It's my great pleasure to welcome you to the 7th World Dental Hygienist Awards ceremony here in Milano. At Sunstar, we believe that better oral health helps people live healthier, better lives. This belief is at the heart of everything we do, and one of the reasons why supporting the World Dental Hygienist Awards is so meaningful to us. Today, we celebrate an extraordinary group of dental hygienists whose work improves lives, advances the profession, and strengthens oral health around the world through research, education, leadership, and patient care. Established by the Sunstar Foundation almost 2 decades ago, these awards recognize excellence and promote advancement within the global dental hygienist community. On behalf of the Sunstar and the Sunstar Foundation, I would like to congratulate all nominees and award recipients. Your dedication and passion are an inspiration of all of us. I would also like to thank the International Federation of Dental Hygienists, the selection committees, and everyone who helped make these awards possible. Thank you all for being here today. Please join me in celebrating this year's award winners.
Thank you, Mayumi, for these beautiful words. And Sunstar Foundation doesn't do it alone, as Mayumi already said. We also partner up from the beginning with the IFDH, and I also wanted to give the stage to Jill Redman, who is the president of the IFDH, and also wanted to say a few words. So applause for Jill.
Thank you, Martijn. So I have a very important question first. Who is enjoying the ISDH and Milano? Absolutely. On behalf of the International Federation of Dental Hygienists, it is my great pleasure to welcome you to the World Dental Hygienist Awards ceremony. Today we celebrate more than individual achievements. We celebrate the impact that dental hygienists have on patients, communities, and public health around the world. These awards recognize outstanding professionals who have demonstrated excellence, innovation, leadership, and commitment to advancing oral and overall health. Their work reflects the very best of our profession and serves as an inspiration to all of us. I'd like to extend my sincere congratulations to all the nominees and the winners. Being recognized among colleagues from around the world is a remarkable achievement. I would also sincerely like to thank the Sunstar Foundation for its long-standing support of these awards, as well as the IFDH Awards Selection Committee for its dedication and its careful work. To all dental hygienists here today, thank you for the difference you make every day. Congratulations to our award recipients, and enjoy the celebration. Thank you.
Thank you, Jill. And I think that's the end of the formalities. Now let's go to the fun part. Because actually, it's not just a celebration of the winners, of course. That's the most important one. But we also wanted to involve you a little bit more in the ceremony. So who was there already in 2024 as well, in Seoul, in the audience? Yes? Okay, a few people may know what's going to come next. But we prepared a little quiz for you. You already connected for the first time. I ask you to pick up your phone again and join this quiz again. And there's a little surprise, because the winner of the quiz actually gets to get a ticket to the gala dinner of tonight. So there's actually something on stake. So please all grab your phones, scan the QR code and connect. I see people connecting. Very good. So while you're connecting, maybe a little explanation. We came up with these questions together with the winners. So the winners provided these questions, and they are introducing their nomination. So, see, 75 people still going up. Let's give it a few more seconds. Even somebody with a little heart. Very good. Still people connecting. Okay. Want to give everybody the fair chance. Still going up, 125, 26. Okay, I think I'm going to move to the question now. So the first question of the quiz is, approximately what percentage of care center residents in the USA receive oral care rated as very good or better? And please note there's a timer there, so we have 10 seconds left. If you haven't joined, you can still join the quiz. Just scan the QR code. 3, 2, 1. There we go. These are the answers given, and the correct answer was C. Only 50%. 50%. So the second question, professional oral care programs in the USA can reduce pneumonia-related deaths in care centers residents by approximately what percentage? 10 to 25%, 40 to 60, or 80 to 90%? Two, one, time's up. A lot of you got this one right. Perfect. 40 to 60%. Okay, so these questions were related to the public health nomination, so I'm going to play the nomination video of the winner in this category.
My name is Shelley Brown, and I'm a registered dental hygienist who owns and operates a portable dental hygiene program called Homebound Smiles in Utah, where I bring preventive oral health care directly to patients in homebound settings. I'll stand, kneel, or jump up on the patient's bed if I need to provide care. What too many people don't realize is that poor oral health fuels systemic inflammation. For medically fragile individuals, dirty teeth are not just a comfort issue. They contribute to serious health decline and even death for these patients. That's what drives my work. To expand access, I created the Mobile Meetup, a program that teaches dental professionals how to start their own mobile practices. For over 10 years, I've also created educational videos viewed millions of times by providers around the world on all things dental hygiene, about what a dental hygienist is and does for patients, and about why professional autonomy matters for dental hygienists, and what that even means. My mission is simple. Every person deserves access to preventive oral health care, and every dental hygienist should be empowered to practice to the full scope of their education without restrictive supervision laws.
I was going to say big applause for Shelley Brown, but you already did, so please, Shelley, come to the stage.
Okay, Shelley, through your mobile practice Homebound Smiles, you're providing essential preventive oral care to homebound and medically fragile patients who are often overlooked. What are some of the most rewarding successes you've seen in improving their oral and overall health? And what systemic changes would you like to see to expand this model of accessible care more broadly?
Let me answer this question with a story. So my very first patient was a dental hygienist with Alzheimer's. And so I want to challenge you that if you are ever yourselves in a situation where you cannot provide oral health care for yourself, maybe you won't even remember that that's important. What type of care would you want? Do you want somebody to come in, a dental hygienist, unrestricted, without all the tangles and the hoops to jump through, to come in and provide you preventive dental care? And yes, you would. I hear some yeses out there. So I want you to think about your states, your provinces, your countries. Is this an option for your country? If not, this is something to most definitely work towards. One of the most greatest opportunities that I had with her is when I first went in, I did a fluoride treatment and I said, "Good job, Shelley, you're amazing." And then I realized that is not going to do enough for prevention for this patient or her caries. So I adopted a whole remineralization prevention program, finding caries sooner, with a product called Blue Check, silverdiamine fluorides, Curodont, povidone iodine, and I can even more prevent caries in this patient population, and that is something that I'm very proud of.
Thank you, Shelley. What an excellent answer. I've got another question for you. You've been a strong advocate for greater autonomy for dental hygienists, emphasizing the need for us to practice to the full scope of our education without restrictive supervision. What progress have you seen in this area, and what practical steps would you recommend to accelerate hygienist empowerment, and I would also add therapist empowerment, and expand preventive care access worldwide?
Thank you for that question. So another experience that I had, so I go see patients in nursing homes and care centers, and a few years ago we could not do that. And a few years ago we also had to have a collaborative agreement from a dentist to be able to do that, and I'd have to call and say, "Going to see this patient?" They said, "I don't care, I love it, you don't need to check with me." But the law said that I did. And then we moved and progressed towards not needing a collaborative agreement. So I get to go about free with my mobile equipment and jump up in the bed with my patients essentially and do their work. And that's really empowering to do. But we asked the question, can we do this? And our legislators and lobbyists and things like that helped us get those passed. But an experience that I had was, I had a patient who was on hospice, and his wife was caring for him. And she at the end of the appointment said, "Can you see me too?" Because she was caring for her loved one. She couldn't leave, and she couldn't go very easily because she was there all the time with her spouse. And I said, "No, I can't see you here. You have to drive, and you have to go, and you have to get somebody to watch your loved one." And it felt unethical to me to have to say no. And that is wrong. And so that's why we have the power to help patients with that prevention through our work, through lobbying and talking with our legislators and educating the public. So I encourage you to do that in places where you live.
Thank you.
Thank you, Shelley. Thank you so much. And that brings us to the second nominee, and I'm going to open the quiz again. So again, grab your phone. See, you're still all connected. So let me ask the first question. How can artificial intelligence contribute to the future of dental hygiene and gingivitis prevention? Ten seconds left to answer the question. Three, two, one. Okay. B. Well, there you go. That was an easy one. Perfect. And the next question. In modern non-surgical periodontal therapy, modulation of the oral microbiota aims primarily to completely eliminate all bacteria, maintain a balanced oral ecosystem and support periodontal health, replace professional mechanical biofilm removal, and avoid patient involvement in home oral care. I think there's a little spoiler in this, so I see an asterisk. Maybe I forgot to remove something. Come on. 93%, yeah. There you go. We have a leaderboard. Bettina is leading the quiz. Who's Bettina? Make sure you do your best in the next questions. Congratulations. It's a close call, so. Let's play the video of the person who provided these questions.
Hello everyone, my name is Andrea Butera. I'm a dental hygienist, research fellow, and the director of teaching activities at the Dental Hygiene degree program, as well as professor of dental hygiene at the dentistry degree course at the University of Pavia. I am very proud to have been nominated for Sunstar World Dental Hygienist Awards at the research category. In recent years, my research has focused on minimal invasive system and natural substances aimed to maintaining the biosis of oral microbiota and the management of both hard and soft tissues in healthy patients and those affected by systemic diseases. I actively share my research with scientific community through publication, social media channels, lectures to the students, and presentation at national and international conferences. And I was delighted to receive the Sunstar European Award in 2024 and truly hope to win the Sunstar Award in 2026 in Milan next July. Thank you all, goodbye, ci vediamo a Milano!
Andrea!
Good morning.
Hello, Andrea. Throughout your career, you have combined clinical practice, education, scientific research, and innovation in dental hygiene. What has motivated your journey, and what message would you like to share with the next generation of dental hygienists?
Thank you for the question, Mayumi. Good morning, everyone. In the first time, my journey to characterize for clinical research and public speaking, but to the connection, the clinical research for the multidisciplinary approach in the research category to systemic disease and oral care for maintaining the biosis states. For next generation, I hope the new dental hygienists believe the love for our profession, to prevention, augment to the skills, and interaction with other specialists for increase the level of dental hygiene in the dental degree course and the living professional. Thank you.
Ciao, Andrea.
Ciao, Jill.
What do you see as the most promising areas for advancing dental hygiene research and education in the coming years, and how can programs better prepare future hygienists for evidence-based practice?
Thank you for questions. Today, the new approach for the education, to the lecture, the tutoring, is a new frontier to artificial intelligence for create a workflow for new communication with the new generation of dental hygiene and for the new collaboration, not only for medicine, but to engineering, computer engineering, and create a new data set for new skill for to improve the clinical practice, but to maintain for the dental hygiene the human rapport for the patient, for to maintain the compliance, the adherence, and non for last, the empathy for the patients is more important. And for the future, for the dental hygiene, it is inevitable to interact with the human artificial intelligence for increase the clinical practice.
Thank you.
You're welcome.
Thank you, Andrea. Big applause for Andrea.
Grazie. Thank you very much.
So again, we come to the quiz for the next winner. Get ready, grab the phone, and answer this question. Which type of oral health content is most likely to receive higher engagement on social media platforms? Evidence-based educational content from healthcare professionals, content that confirms existing beliefs or fears, regardless of accuracy, peer-reviewed research summaries, or professional association guidelines. Okay, let's see. It's answer B. Quite divisive between A and B, but it's actually answer B. Next question. Research on health misinformation has shown that false information often spreads slower than accurate information, at the same rate as accurate information, faster and farther than accurate information, or only within niche communities. Three, two, one. Yeah, you got most of you got that right. So I'm going to play the video of the nominee who won this category.
Hi everyone, my name is Whitney DeFogio and I'm a registered dental hygienist and the founder of TeethTalk.com, where my mission is to make oral health education accessible, fun, and evidence-based for everyone around the world. Every day I share free educational videos and articles to help people feel less anxious about visiting their dental office and more empowered to care for their smiles at home. From brushing and flossing tutorials to myth busting and the oral systemic link health education, I'm passionate about helping people understand that prevention truly starts with awareness and education. My videos reach millions of viewers globally, especially those who don't have access to regular dental care. Knowing that someone learned how to take care of their teeth because of something I created, that's why I do this. So as an entrepreneur and proud dental hygienist, I'm honored to be considered for this award and grateful for the opportunity. Thank you, Sunstar.
Big applause for Whitney in the entrepreneur category.
Hi, Whitney. Hello. With your background in biology, health communication, and your ongoing doctoral studies, what advice would you give to other hygienists interested in expanding their impact beyond the operatory, particularly through digital tools, to elevate the profession and empower global audiences with preventive oral care knowledge?
Yes, so dental hygienists have so much knowledge, and digital tools, I think, make it such an incredible opportunity to extend that knowledge beyond the dental chair. So my best advice would be share your expertise in whatever way is appropriate for your role in your community, and you don't need a large audience, you don't need fancy equipment. All you need is to make sure you're sharing accurate, evidence-based information in a relatable way, right? And I truly think the future of dental hygiene and dental hygienists includes us being healthcare communicators as well as healthcare providers. So only strengthening our profession is improving oral health literacy, and improving oral health literacy is strengthening our profession.
Thanks, Whitney. I have to say it's nice to actually see you in person. We've all seen her online, and to see you in person it's really a thrill, so thank you. So your work as, and I love the name, Teeth Talk Girl, has reached millions of people by translating complex, evidence-based oral health information into accessible and engaging content. In an era of widespread misinformation online, What strategies have you found most successful in helping the public make informed decisions about their oral health?
So instead of expecting people to read scientific papers and interpret data, I translate that information into language that is easy to understand in a hopefully relatable way with storytelling and visuals on the screen. And on top of that, I really try to understand why certain myths are popular or trending, as opposed to dismissing people for believing those myths, right? I believe when people feel respected instead of judged, they're more open to learning, of course. So ultimately, I think improving oral health literacy, again, is less about correcting misinformation and more about giving people and our patients the confidence to make their own informed oral health decisions.
Thank you.
Thank you, Whitney. So let's move on to the next winner. Grab the phones again. Side effects of chemotherapy in the oral cavity can include: there are no side effects, primary and secondary, immediate or late term, or both B and C. Both B and C. Oh, that's not right. That's not correct. Okay, we'll skip this question. It should be D, I remember. It should be D. So you all did well. The patient undergoing chemotherapy constantly moisturizes his or her mouth with water or its derivatives, alcohol-based mouthwash, fluoride-based mouthwash, or again, both A and C. Yes, this one is correct. Great. So I'll play the video of the winner in this category. First we have a leaderboard. Katie is now leading. Katie? Should be good. Congratulations. So this is the video of the winner.
Hi everyone, my name is Stefania. I'm a dental hygienist. In 2020, I have created a guide for help cancer patients before, during and after chemo and radiotherapy. Many patients are not informed for the side effect of the treatment. Many of these guides have helped women with breast cancer. They are patients with a very special needs, and as a dental hygienist, we can help them. Vote for me. The prize will go to a charity center that help women and children.
Thank you, Stefania.
Benedetta Stefania. Allora, what key practical advice you would give to hygienists and oncology teams working with these patients?
During radio and chemotherapy, we focus just on the treatment. So it is important because there are very serious side effects in the oral cavity, as xerostomia, halitosis, opportunistic infection, mucositis, and osteoradionecrosis and radionecrosis. The dental hygienist, it's very important because we can save their life. For example, in the 4th and 5th stadium of mucositis, the oncologist can decide to stop the therapy, the patient are going to die. So we are not important, we are necessary.
Ciao, Stefania. You created the Oral Hygiene in Chemotherapy and Radiotherapy Guide, which has been recognized for its impact. Could you share with us why the dental hygiene profession plays such a critical role in managing the oral cavity for patients undergoing radiation and chemotherapy?
We have to make a prevention of the prevention. It means that we don't have to wait that side effects are going to become severe. We can manage with probiotics, with remineralized toothpaste or mouthwash, and with salivary substitutes. It's important to work together with other therapists and speak. We study what's happened in the mouth, so we have to do this work for the first. We have to communicate this to the patients.
Grazie.
Once more, give it up for Stefania. Quiz time again. Which traditional oral hygiene aid has demonstrated clinically significant reductions in plaque accumulation and gingival inflammation and is recognized by the World Health Organization as an effective oral hygiene tool? Activated charcoal powder, the miswak, lemon and salt abrasion therapy, or topical clove oil application? Most people answered B, which is correct, it's the miswak. Yeah. Next question. According to the common risk factor approach to public health, which intervention would have the greatest impact on improving both oral and general health outcomes? Increasing the frequency of routine scaling appointments, expanding access to tooth whitening services, reducing free sugar consumption at the population level, or increasing the use of antimicrobial mouth rinses? You answered answer C, and that's the correct one. So the winner in this category actually graduated not so long ago. So let's play her video.
Hi, my name is Janet Williams-Ushen. I'm a registered dental hygienist from Trinity College Dublin. This is my video submission for the World Dental Hygienist Sunstar Award for the new ISDH category. Over the 2 years, I've worked in multiple private and public dental clinics and hospitals, which has allowed me to gain extensive clinical experience working with a wide range of patients from all ages. In my spare time, I've organised and delivered oral health presentations to children from disadvantaged backgrounds, adults with varying intellectual and physical disabilities, elderly men, and business professionals. I've also collaborated with dental brands like Sensodyne, Colgate, Corsadol, Dental Health Foundation, and Kin Dental to provide samples for these groups. I currently volunteer for the Irish Dental Hygienist Association, serving as the website and employment officer, which allows me to give back to the dental hygiene community. In addition, I researched the effects of diverse oral practices on our oral health with the aim of highlighting the importance of culturally inclusive dental care. Based on my research project, I published an article in the FMC Dentistry magazine and in the IDHA Autumn Journal 2024. I also had the opportunity to share my findings at the NSK Ikigai webinar and the Irish Dentistry Show to international and national dental health professionals. At the moment, I'm working on 2 upcoming articles to be published in the IDHA Spring Journal this year and the International Symposium on Dental Hygiene. I'm Janet Williams, and I aim to enhance oral health education and continue contributing to new dental research. Thank you for taking the time for watching my submission and considering me for this prestigious award.
In the new RDH category, please welcome Janet Williams-Ushen.
Welcome, Janet.
Thank you so much. Hello.
Hello. In your video submission, you described delivering oral health presentations to diverse and vulnerable communities. What have been some of the most rewarding outcomes or challenges you've encountered in these outreach efforts? And what advice would you give to other hygienists looking to expand their impact beyond the clinic?
Well, thank you so much for the question. So one of the most rewarding parts of doing this oral health educational project, I think, is seeing the immediate impact that it has on the patients. Whether it be children, adults with disabilities, elderly people. I just love doing these talks and then seeing that confidence in them that they want to go ahead and improve their oral hygiene. For me, it's not just about giving step-by-step instructions on how to do cleaning your teeth, flossing. I think it's really important to make oral health feel accessible for every individual from every background, but especially those from vulnerable communities. So when it comes to advice for other hygienists in terms of trying to get more involved outside of their community, I think it's just really important to realize that you're a dental health professional, you have the knowledge, you have the education behind you to go out and educate others, promote oral health promotion, and empower your community and beyond that. So it's really just stepping outside of your comfort zone and finding something that's passionate for yourself and not underestimating yourself.
Thank you, Janet, and welcome.
Thank you.
You explored the impact of ethnic and cultural oral practices on oral health and the need for culturally inclusive dental care. Could you share a key insight from that work that has changed how you or your colleagues approach patient education, and how oral healthcare professionals can better integrate cultural awareness into everyday practice?
Thank you so much for that question. So when it comes to my research, the most important part for me was realizing the importance of culture and that it's ingrained in absolutely every single one of us, and that affects our everyday lives, our habits, including our dental health. So when it comes to promoting oral health, I thought it was really important to focus on that when I'm communicating with my patients. It helped me to connect with them better and also to create more tailored oral hygiene advice. So for other dental professionals that want to be more culturally inclusive, I think it's just taking that time, having those conversations with your patients, opening those discussions, building that rapport with them where they feel comfortable to tell you a bit more about them, and not everything is, unknown just because it's different to what you're maybe used to. Because in their culture, maybe that's their norm and what they're used to as well. And I think just taking that personal initiative to educate yourself about diverse oral practices worldwide.
Thank you.
Thank you, Janet.
Thank you so much.
Okay, so the final questions to this quiz, so get ready again. Final two questions. Which local anesthetic injection technique has the highest reported positive aspiration rate? Posterior superior alveolar nerve block, greater palatine nerve block, the inferior alveolar nerve block, or mental incisive nerve block? Nice technical question from our next winner. Three, two, one. Majority had it right. Well done. Next question. A patient with severe hepatic impairment requires local anesthesia for periodontal therapy. Which anesthetic is most appropriate based on its pharmacokinetic profile? 2% lidocaine with 1 to 100,000 Okay, I'm not going to read these answers. You can read them yourself. Most of you answered A. It's actually answer B. So these were the last two questions, and I'm now going to play the final video of this. But first, let's have a look at the leaderboard, because we have a winner, 10 out of 12 correct. Heather. Where's Heather? Ah, there you are. Well done, congratulations. Just come to the stage after the ceremony and Yeah, congratulations again. And thank you also for everybody else participating in the quiz, of course. So now the final video.
Hi, my name is Dr. Elmer Gonzalez. I am a dental hygiene educator dedicated to prevention, education, and expanding access to oral health care. In 2019, I established the Happy Smiles program to connect dental hygiene education with meaningful patient care. As the program grew, it expanded beyond the school clinic into multiple satellite locations, including community health centers and outreach sites, allowing students to serve underserved children, families, and individuals facing barriers to care. What began as a local educational initiative expanded into international service learning experiences in India, Costa Rica, and Vietnam. These experiences strengthened clinical training while fostering scholarly inquiry, preparing future clinicians, educators, and researchers to address oral health challenges across diverse populations. I also developed educational pathways that support professional and academic advancement. From dental assisting to hygiene, from associates to bachelors, from bachelor's to master-level degree education. As an educator, my goal is simple: to prepare dental professionals and improve lives locally and globally.
For the final time, big applause in the academia category, Elmer Gonzalez.
To the stage. What has been the most meaningful outcome you've witnessed, either in the communities served on or in the students who participated?
Thank you for that question. I think for educators here in the room and myself, picking one would be difficult. I think it's a twofold. I think seeing patients have access to care, children, communities all over the world, is definitely one of the big achievements. But also being able to train students. When you see students get out there, outside of the dental clinic, outside of the classroom setting, and practice their skills, learn more skills, not only in the local community, in the state, but also in communities, again, around the world, is very rewarding.
Thank you, Elmer. And I just have an initial comment here. If there was any doubt that you were an academic, all we needed to do was read your quiz questions to know that there is no doubt at all. Thank you. So, Elmer, your Happy Smiles and Happy Smiles International programs have brought preventive oral health services and education to thousands of children and families in underserved communities, both in the U.S. and worldwide. What initially inspired you to launch these programs?
Wow, thank you for that question. I'm going to answer with a little bit of a story, and that's going to reflect my inspiration. I was born in Mexico, and I moved at the age of 18 to the United States. But being born in Mexico, I experienced firsthand the lack of access to preventative oral health care in my communities, but also in other communities in Mexico. When I came to the United States, I had the privilege and the honor to work for a special need population. I started as a caregiver while I was going to dental hygiene school, and that actually inspired me to become a dental hygienist, seeing the need of the special needs populations, the individuals with developmental disabilities. And going from there, I also noticed and realized that access to care for that population was very limited. I realized that it was not only in Mexico, but also in the United States, that access to care was lacking. As a hygienist, I had the opportunity to work in a special needs clinic at the University of New Mexico, where I served mainly individuals with disabilities for about 7 years before becoming the program director in Las Cruces, New Mexico, where I work now. The Happy Smiles program, those were the roots of where Happy Smiles program started. When I moved as a program director, obviously I realized that students had many challenges in recruiting patients to complete their clinical requirements. So being able to bring oral health access to the communities we serve, instead of expecting the communities to come to us, was a key factor in the Happy Smiles program, which relates to what my colleague here was saying as well, taking the mobile dental clinics to the homes, and also what the audience put in the very first slide, access to care, community, public health, that is Happy Smiles.
Thank you, Elmer. Muchas gracias.
Thank you, Elmer. And with that, we actually go to the final part of this award ceremony because we have an actual trophy handover. So again, I would like to ask you a big applause for, first, Shelley Brown. Thank you, Shelley. And that brings us to the second winner that we introduced to you today, Andrea Butera. Big applause. Thank you, Andrea. And the next one was Whitney DiFoggio. Big applause again. Thank you, Whitney. From Italy, Stefania. Congratulations once more. Then Janet, please come forward. Big applause for Janet. Thank you, Janet. And finally, a big round of applause for the final winner, Elmer Gonzalez. Congratulations, Elmer. And with that, we come to the end of this ceremony. So thank you all for being here. Thank you for participating in the quiz. And enjoy the rest of your congress. Goodbye. Thank you.